Hi everyone and welcome. Today we're going to be talking about all things kids. You know, summer's upon us and of course the kids are going to be outside playing a little bit more. So sometimes they don't make all the right choices and they could get in trouble, have a little bit of an accident here and there. So we're going to be talking today about how to keep them healthy, how to keep them safe during these months. Joining me right now is Dr. Allison Bollinger. She is an ER doctor with St. Thomas. We're so glad you're visiting with us today.
Thank you.
Thanks for your time. I know you're very busy. So
Some days.
This is terrific for us. I know you've been practicing in Tennessee for a while. Tell folks out there how long you have been practicing, especially when we're talking about the ER.
Well, I moved to Nashville 7 years ago to do my residency at Vanderbilt.
Okay.
I graduated in 2011, so I've been a ER doctor for 4 years.
Excellent.
Yes.
Now, I know, as I mentioned, you know, kids are out and active a lot more in the summertime. Do you find that the ER is more active as well during these months, or would you say it's constantly just buzzing all year round?
I feel like the chaos comes in swells, but certainly in the summertime, it is busier with traumatic injuries. We see a lot more of that in the summer. Much more medical illnesses in the wintertime, but definitely trauma in the summer.
Let's talk specifically about some of the things that you treat in these summer months when we're talking about kids, because as I mentioned, when we're talking about being active, I mean, there's all sorts of activities they're involved with. Swimming being one of the first, you know, things that they're out doing, or any kind of sporting kind of activities. What is the biggest thing that you all see that comes through? If it's broken arms or if it's, you know, I don't know, poison ivy or whatever it might be.
We see a little bit of everything. I will say that broken bones, lacerations, sprains, strains, all of those sorts of things are run-of-the-mill in the ER in the summer. Other things that we see are poisonings. You'll see poisonings from, like you said, poison ivy and things like that, but also from different chemicals that children might have gotten into. They're out and about in the woods and they're exposed to things that they might not normally be exposed to in the winter.
Yeah. If parents are watching, for those who are, what would you tell them as an ER doctor of how their experience will start off in an ER? Because I know, you know, you're just trying to rush your child to get that immediate care as soon as possible. But what can they anticipate in walking into those doors?
So certainly, when they walk into the front doors, they're going to go up to a desk where they'll meet a triage nurse.
Okay.
And that nurse is very well trained in trying to differentiate levels of acuity. So they may say, this kid looks sick, get him back right away, and pull him straight back to the emergency department where we are, the doctors are. At other times, it may be full and they may say, this looks like it can wait 5-10 minutes. They usually get a brief sentence about what's going on, write it down, get some vital signs, and then you may have to wait for a while depending on the acuity of the other patients in the emergency department.
Yeah, I was just going to say to every parent, every case is an emergency.
Certainly.
That's why you're there. But obviously there are priorities that you all have kind of behind the scenes that folks aren't aware of. Would you say there are certain things that you say right away, we have to rush this child back? And what would those things be?
Certainly major traumatic injuries are things that we, you know, heavy bleeding, where it looks like bone are exposed, anything like that, we would rush back right away. Also children who are acting strangely, listless, confused. Most children should cry when they go to the emergency department. They should cry when someone tries to touch them. And so it actually is more worrisome when you see a child who doesn't seem to be bothered at all by the fact that other people are looking at them, poking at them, prodding them. And we would bring those back sooner rather than later.
That's a great point to make. Because I said there are so many sporting activities that are happening, what would you tell parents or anyone who's listening who's a child care specialist of some sort, you know, caregiver of some sort? When do they decide to go to the ER as opposed to just waiting for their doctor or going to an urgent care clinic or something different than an ER?
That is the age-old question asked by my family and friends and every person I know. That's a tough question, but I will say that your pediatrician is your ally. If this is not something major traumatic, sudden, but something that may have come on gradually throughout the day, call your pediatrician. That's going to be your major ally. They're the ones that know your child's health history, and they can typically try to direct you in the right direction, either to an emergency room, to an urgent care clinic, or maybe a same-day appointment in the pediatrician's office. I'd also like to direct people to the Poison Control Center. If there's a poisoning or an exposure of some sort and you're not sure what to do, the Poison Control Center can really help you try to decipher when to go to the ER and when you can stay at home.
Okay. As far as kids outdoors swimming, I know that unfortunately some kids have had to go to the ER because of issues in the pool or whatever the case may be. Do you suggest that someone in a family knows CPR, or someone in a family has that first aid kind of care that they're aware of for any child who is in some sort of traumatic situation within, a pool environment?
Absolutely. That is so key to making sure that children are, well, certainly prevention is key, but if the worst case scenario does happen, a child has drowned, a near drowning, there needs to be someone who has the capability to do chest compressions, to do breaths for the child, and to know that level of care to be able to provide for that child.
Sure. You mentioned kind of poison control a couple times. Tell folks about your background in that specifically, because you have, kind of some schooling on that, to where I don't know if every ER doctor does.
So every ER doctor does. It's just an area that I think is particularly interesting. I like toxicologic emergencies. I loved my toxicology, it's hard to even say, toxicology rotation and residency, and most residents do some time in toxicology, but I found some particular interests in that. And I think that in the summertime is when we're especially exposed to all these hazardous chemicals and drugs and things like that. So
whether it be repellents, bug repellents, or even kids getting into the places they shouldn't under the sink and things like that. What is the first thing that someone should do, besides taking their child to the ER, if they do think that they've gotten some poison in their system of some sort?
The Poison Control Center. They are so knowledgeable up there. I call them from the ER. I say, hey, this child ingested this. What would you do? Because they are really your ally. They know everything about every different chemical that you could possibly find. They have an entire list of symptoms to look for, how long you should watch them, and so forth. And so if you have a concern, you should call the Poison Control Center right away.
Okay, something else that we know is a specialty of yours, or maybe I'll just say it's a specialty of yours, is anything dealing with the skin, some dermatology issues. So what can kids get into in the summer that, you would notice? I mentioned poison ivy a little bit earlier, but is there anything else that parents should be aware of?
Well, specifically dermatologic emergencies, certainly there's a lot of dermatologic conditions that are not emergent, but the skin is your largest organ of your body, and it is the reason that you are protected from all the elements. And so when it breaks down, you break down. And so I would say that my particular area of interest in dermatologic emergencies is trying to decipher what's dangerous and what's not, because it's oftentimes hard to tell. But children who are exhibiting signs of systemic illness with a rash, so not just a rash, but they have fever, they're vomiting, they don't look right. Children who are having blistering or sloughing of the skin, that's more worrisome. And certainly children who are having areas of rash that don't blanch. And what I mean by that is when you press on it, it doesn't turn white for a short period of time and then go back to red. You press on it, the color of the skin doesn't change at all.
Okay. Great. One last thing I want to ask you, Dr. Bollinger. Is there any specific rule of thumb or advice that you can give that's very brief to parents about summer season for their kids?
Watch them. Make sure that if they're in an environment like a lake or a pool, that you have very clear perimeters around that so that they don't get close enough that they could fall in. Children can drown in an inch of water.
Sure.
So keeping an eye on them when they're doing activities and also around the pool.
All right. ER Dr. Alli Bollinger, thank you so much for your time today.
Thank you.